Hello, everyone. My name is Gabbie Ruggiero, and I work at Employee and Family Resources as a substance misuse prevention specialist, specializing in overdose prevention. And at EFR, we provide education to folks as young as preschool all the way through adults about substance use and social and emotional learning as well for the younger kids. Today, we're going to be talking about harm reduction and how we can reduce risks associated with some behaviors, specifically with substance use. So we're going to jump right into the slides, and then at the end, Johanna will talk a little bit more about other services that EFR provides. So whether you know it or not, we engage in harm reduction behaviors every day because we all engage in risky behaviors every day. So if you live in the Midwest, like I do, we all probably hop in our cars quite a bit to get around. And driving is a pretty risky behavior. People get in car crashes all the time, but there are some things that we can do to reduce our risk of getting in a car crash. So putting on your seatbelt reduces fatalities by 50% in a car crash. So I put on my seatbelt when I get in my car. I also put on my turn signal and try to go the speed limit, but I don't always go the speed limit. So something we can take from that is that harm reduction behaviors or reducing our risk exists on a spectrum. Everyone isn't going to engage in every risk reduction behavior possible, but we do our best, right? We try to reduce our risk in some ways. Other things that reduce our risk could be putting on a life jacket if we're on a boat, wearing neon if we're hunters. We all are going to go outside, and there's a risk of sun exposure and skin cancer from the sun. And so putting on sunscreen can reduce our risk of long-term consequences of sun exposure. And then most of us know that eating fruits and vegetables and engaging in regular physical exercise will reduce our long-term risk of chronic diseases. But again, I don't know about you, but I'm not eating fruits and vegetables as my only food all the time. And so again, when we're thinking about harm reduction and reducing risk, it's not all or nothing. We're not necessarily going to engage in every risk reduction behavior, but what we do can be helpful for us in the long run. So when we think about harm reduction in substance use, things get a little bit trickier because generally substance use has been seen as a moral problem in our society where people should just say no, as I'm sure many of you heard in growing up in school with your drug education. Maybe you did the DARE program, which again was all about abstinence or not engaging in any substance use. And harm reduction does not say that substance use is a good thing. It also doesn't say that substance use is a bad thing. We're simply going to meet people where they are, wherever they're at with their substance use, whatever they're doing or not doing, and try to reduce the risk of behaviors associated with substance use. And so to just put a bow on it with a definition for our time today, we are going to say that harm reduction refers to strategies directed towards individuals or groups that ultimately aim to reduce the harms and risks associated with some behaviors. So for some folks, abstinence or not using substances is a healthier choice for them. Maybe they have an addiction and not using substances would be helpful for them. However, it's really hard to stop using drugs if someone has developed an addiction because their brain has changed. It's also pretty difficult to seek treatment and stay in treatment or even get mental health care. So it might be that someone isn't ready to stop using, or it might be that they don't have the resources to stop using. And so that means in the meantime, we want to help this person have healthier outcomes or a healthier life. and we want to keep them alive. And as one activist in the harm reduction movement put it, I can't stop anybody from doing what they want to do, but I can keep them alive until they want to stop. So when we think about harm reduction, we have to put our judgment at the door and know that we're trying to help people live their healthiest life in the best way that they can. So because harm reduction is a movement and is a set of practices, I want to highlight a couple of principles of the movement and of these practices. And I'm not going to go through all of these, but there's a few that I want to highlight. So first, we are going to accept, for better or worse, that illicit drug use is a part of our world, and that we're going to try to work to minimize harmful effects. So people have been using substances as long as there's been recorded history. So we know that it's going to happen. We have a lot of legal drugs people use. And so we're not going to ignore it. We're not going to condemn it. We're going to try to reduce risk. We're also going to understand that drug use is a complex phenomenon that encompasses a continuum of behaviors. So substance use exists on a spectrum. There are some people who don't use substances at all. There are some people who use them recreationally or just for fun, maybe when they're just with other people. And then there are some people that will develop a physical dependence on substances where they need that substance to feel normal throughout their daily life. And there are some folks where they will develop a chronic brain disease called addiction. So we want to recognize that there are some substance use behaviors that are riskier than others, but any progress towards less risk is helpful. So if we can move people from chaotic use just to moderate use, that's a win, even though it might not be the ideal outcome. We're also going to ensure drug users and those with a history of drug use have a real voice in programs surrounding them. So a lot of times people who use drugs are left out of the conversation of policies that could help people who use drugs, and that really does a disservice to everyone. So for example, we have these opioid settlement funds from these lawsuits against opioid companies or drug companies. These funds are being funneled into our communities, and so something to think about is, are people who have been impacted by the overdose crisis actually having a say in what that money goes towards? The next two I want to highlight up there on the purple box is that harm reduction calls for the non-judgmental, non-coercive provision of services and resources to people who use substances and their communities. So we're not forcing people into treatment or forcing them to engage in services if they don't want to do that. We want to honor people's autonomy and make sure they feel like they have a say in their treatment or in their lives. And right in along with that is in the blue box, we're affirming drug users themselves are the primary agents of reducing the harm of their drug use. And we're empowering them to share information and support each other in strategies which meet their actual conditions of use. So we're giving the tools without saying this is what you need to do with the tools. And any step towards a healthier outcome should be celebrated. If we have people who use substances in our life or have an addiction, it can be really difficult to think of any progress as good when we know that abstinence might be the best for that person. But harm reduction is really about making sure that person is in control of their treatment plan and celebrating any progress along the way. All of these principles really boil down into this maxim of harm reduction that we're meeting people where they're at. So wherever they're at with their substance use, we're going to provide appropriate services. And we're also going to physically meet people where they're at. So making sure that services are accessible to people so they can actually engage in harm reduction practices, which we'll talk about here in a second. Also important is that harm reduction is also a social justice movement built on the respect for the rights of people who use drugs. So historically, people who use substances have been discriminated against, policies have been enacted to target certain types of drug users, and I say types in quotation marks. There's a big tie-in with racial discrimination and people who use substances being discriminated against. So there's a whole other arm of harm reduction that focuses on protecting the rights of people who use drugs. So just a few examples of how social justice has been tied into the harm reduction movement. On the far left blue box, we have the Black Panthers Party survival programs. So part of the Black liberation movement, there are free meal programs for anybody who needed food, or free health clinics for anybody who needed health care. And traditionally, people who use drugs haven't felt comfortable getting health care in traditional healthcare facilities because of stigma, which we'll talk about here in a second. So they were, come as you are, and you can receive services from us. On the other side of the slide, the other blue box, we have the tie-in to grassroots and activist response to AIDS and HIV in the 1980s and beyond. So there is an association between infectious disease transmission and injecting drugs. So people who might have HIV or AIDS may have also engaged in substance use. And so there is a lot of joint discrimination or compounded stigma where people were feeling stigmatized for their drug use, but also feeling stigmatized for their HIV status. So again, when we're thinking about the history of harm reduction, we could do a whole webinar on this, but I also want you to keep in mind that there's a social justice element. And if you're interested in learning more about this, I'd encourage you to go to the National Harm Reduction Coalition's website. I mentioned that people who use substances might not feel comfortable in a healthcare setting because of discrimination that they may have faced. And I wanted to highlight a few voices of people who have lived experience here in Iowa, but you will find this across the country if you're tuning in from places other than Iowa. But it's important to listen to the voices of people who've experienced this. So first, the only way to get into treatment real quick is to know the right person. Otherwise, nobody is going to help you. I was told it's not worth treating me because I wasn't going to live anyway. I didn't want a physician to find out about an abscess because then they'd know about drug use and I would get labeled a drug user. So if we can try to put ourselves in these folks' shoes for a second, if we were to hear these things in a medical setting, we go to the doctor, or we're not able to even go to the doctor because of stigma, we might start to turn to alternative types of healthcare. And so traditionally, harm reduction coalitions or groups of people who have lived experience tend to help other people who use substances or have lived experience because they've been there and they know it'll be a non-judgmental way of getting help. So stigma, fighting stigma, talking about substance use as a medical issue, all of this is harm reduction because it reduces the way that people, the stigma that people may experience in a healthcare setting, and peer support is such a huge part of this. Now I'm going to talk about how harm reduction is put into practice. So we kind of have thought about this as a concept and as a movement, but now what are some things that we actually do as a community or as individuals to reduce our harms? I first want to stop and recognize that harm reduction policies and practices have real positive outcomes on our communities for both individuals and society as a whole. So practicing harm reduction reduces infectious disease transmission. It decreases drug overdoses. We know overdose deaths are happening at an unprecedented rate right now. So anything we can do to help is important. It also saves the public money and supports public safety partners. and it increases access to treatment and engagement in treatment. So the first set of harm reduction things that I want to talk about is for illicit drugs, because people don't necessarily think of harm reduction as something you can do with legal substances, but you certainly can. So for example, folks might be using nicotine replacement strategies if they are someone who has smoked cigarettes. So having a nicotine gum or a patch can be harm reduction because they're not inhaling the carcinogens into their lungs when they're smoking a cigarette. However, we know that nicotine itself still has harms on the body. So we are reducing risk, reducing harm by using nicotine replacement. However, we're not going to abstinence completely, but this is really good progress for somebody who has been a long-time smoker, for example. So this is harm reduction. When we think about alcohol, education is such a huge part of alcohol harm reduction, especially for young people who haven't engaged in alcohol use yet. So do people know that it's important to alternate having a drink of water or a glass of water with alcoholic beverages? Eating slows the absorption of alcohol into the body. Planning ahead. So are we understanding the risks of getting into a car and driving when we use alcohol? And a big part of this is knowing how many drinks is too many before getting into a car. And so something we talk about with young people on our prevention team is the rule of 1 drink, 1 hour. So your body can only process alcohol at a rate of 1 drink per 1 hour. So if we're thinking about when is it safe to drive, we have to know, well, what is 1 drink? And so we talk about the standard drink. So what you see on the screen, those 3 things, those are technically 1 drink of alcohol. So one of those can be processed through the body in 1 hour. So education is a huge part of harm reduction. And harm reduction exists on a spectrum from talking about things, education, all the way to providing tools to help reduce risk and actually use in a safer manner. There are a lot of harm reduction strategies that we could focus on. I just wanted to put an overview here before I dive into a few a little deeper. We already talked about education, anti-stigma efforts. Resource sharing is really key, especially if you're someone who works with people who use substances. Do they know where they can get help? Access to supplies to use in a safer manner, like NARCAN, the opioid overdose reversal drug, is really important to have access to. And then also policies such as jail diversion, like drug courts, or having affordable housing so you can actually engage in treatment, and then having something like the Good Samaritan law. Now in Iowa, we do have a Good Samaritan law, and this is a harm reduction policy because it encourages people to call 911, even if, in the case of a drug overdose, even if they themselves have substances on their person or paraphernalia on their person. And this is not a perfect law. There are a lot of provisions to it, and I encourage you to go to yourlifeiowa.org to learn more about it. But this is good because it helps people feel more comfortable calling 911. This also protects people who are in a position to help someone experiencing an overdose. So by using NARCAN, for example, so you're protected if you give someone NARCAN from any legal ramifications that might happen. Another harm reduction strategy that has been getting a little bit more airtime in the news recently is something called a fentanyl test strip. And fentanyl is an extremely powerful opioid that is driving the overdose epidemic right now. So in our state, for example, the state of Iowa, 87% of overdoses in 2021 were linked to fentanyl. And unfortunately, people don't always know that fentanyl is in whatever substance they're using. And so a fentanyl test strip is a piece of paper that is there in that photo that looks a lot like an at-home COVID test, where you take a little bit of your substance and dilute it in water, and then you put the test strip in there, and it will indicate with lines whether or not fentanyl is present. So when people know that fentanyl is in their drugs, they can engage in harm reduction practices. So for example, they might use less of the drug and go slow with using it. So they might wait between doses of that drug. They might have other people there in case something goes wrong. They might have naloxone, which is the generic name for the NARCAN nasal spray that reverses opioid overdoses. And they might just throw away that drug altogether. So this is a strategy. It's not a perfect strategy, but we're just going with examples, especially since this has been getting a lot of airtime, because fentanyl test strips are currently illegal in Iowa due to paraphernalia laws. So just something to keep in mind, that there are some people who still think of drug use as a moral issue, that maybe this would enable people who use drugs. But fentanyl test strips do allow people to engage in harm reduction strategies that save lives. Naloxone is also a huge harm reduction policy, or access to naloxone is a huge strategy to reduce overdose risk. And when we're thinking again on the spectrum of harm reduction, we don't ever want someone to get to the point where we need to reverse an opioid overdose, but it's a part of a tool, the tools in our tool belt to reduce risk and reduce harms. So naloxone is something that anyone in our state can get for free without a prescription. You can go to the pharmacy and ask for a box of Narcan. It's really easy to use. I encourage you to go to naloxoneiowa.org to learn more about how to use Narcan and where to find it for free in our state. And while it is more accessible by being able to go to a pharmacy and get it without a prescription, a lot of people who use drugs that have experienced stigma in healthcare might not be getting Narcan because they're not engaging with traditional healthcare. So in one Iowa study, roughly half of people who use drugs said that they don't have Narcan or other forms of naloxone. So this is highly concerning because we want naloxone to be in people's homes. We want it to be in public spaces. There's been more of a push to have it in healthcare facilities, to have it in public buildings, but maybe there's more we can do. Some folks have proposed that this be more of an over-the-counter medication. For example, I do trainings on how to use Narcan all the time, but because I'm not a pharmacist, I can't give it to somebody. So that would just be a way that it could be more accessible. So again, thinking about harm reduction as a social justice movement, there are some folks that do a lot of advocacy work about these types of things. And so I encourage you to check them out, and I'll tell you what they are here in a second. So I could do a 2-hour presentation on harm reduction. So I hope that this at least piqued your interest in learning more. So I wanted to give you a few more resources so that if you are interested, you have places to go. So first, we did an Emotion Well podcast on harm reduction in December of 2021, and it's not all repeat information, so I'd encourage you to listen to that. And in the show notes of that podcast, there's links to a couple other resources where we can hear the voices of people who use substances, which is really important when we're talking about these issues. You can also check out yourlifeiowa.org, which provides crisis services for people who are experiencing a mental health crisis or are having trouble with substance use. But it also has a wealth of information on these on substance-related topics. And then I really encourage you to check out the Iowa Harm Reduction Coalition's Facebook page. They have a lot of educational posts. We can learn about what they're doing. And this is a group of peers who have lived experience that are directly providing services to other people who use substances. And if you're not from Iowa, the National Harm Reduction Coalition is a really a great resource. You can find them online, their website. There's education there, but then there's also a finder tool, so you can find local services in your area. So if you're not in Iowa, it'll tell you harm reduction services in other parts of the country as well. All right, so I know I'm looking here and I'm not sure if we can get chats from participants. So I'm going to put up my contact information here that you can jot down, and please send me any questions that you have. I'm happy to have a quick phone call with you or respond to any emails. So please feel free to reach out.
Thank you, Gabby. I am always very interested in this topic, and last year Gabby did, I want to say it was a 2-hour workshop for our own team members at EFR on this topic. So there's so much more we can get into with harm reduction, and I just want to thank Gabby for just scratching the surface for us today and giving us some of that base knowledge that I think is so important. As a reminder, if you're listening and have EFR's benefits, you have access to 24-hour phone support by calling our 800 number. In-person or virtual counseling sessions are available. We also have telephonic resources like financial consultation, legal consultation, elder and child care resources, identity theft resolution, and life coaching. So real briefly, without getting too far down the rabbit hole on what your EAP can provide, think of it as a lifeline or as a support system or as that group that you refer to when life is just kind of weighing you down. We say life happens, we're here to help. So whether it's stress from a relationship, grief from loss, changes because your kid just started college or kindergarten, whatever it might be, you can definitely reach us 24 hours a day and set up your services. It is a completely confidential benefit, and we are here to help you. In addition to our EAP benefits, you can stay up to date with us via our app. You can find our app in the Apple or Google app stores. From there, you just search EFR, download the app. It is free, and there's some nice features in the app, and it's also just a way to keep your EAP benefits more front and center, because I think oftentimes in that moment when you really need to talk to someone, who is our benefit provider? What is their number? Is it EFR, EAP? It just gets kind of confusing, especially when you're feeling overwhelmed. So if you can download the app, go ahead and do that, and then you know that you have our contact information in your device. In addition to the app, we have a podcast, Emotion Well. Gabby was our guest in December of 2021. And so that episode can be found if you download the app, or even if you visit our website. You can also find our podcast in Apple Podcasts, Google Podcasts, Spotify, or wherever you find your podcasts. But each month is a new topic, a new guest, and we have a lot of great podcasts available for you to listen to, a lot of great episodes for you to just learn more about why emotional wellness is so important. And then we have an upcoming webinar in October, Steps to Success, Wellness Programs at Work. I will be presenting this along with my colleague, Kylie Mitchell. This is going to be October 20th at 10 a.m. Register on our website under the Stay Connected menu. You could also find this in the app. So know that the app has everything that our website has in terms of podcast, blog, watching past webinars, registering for webinars. And as Gabby mentioned, there is a short survey that we put in the chat, but you'll also get an email link within the hour or so to take that survey as well. I don't see any questions in the chat, but if there are, please enter questions for Gabby, or if you'd rather connect with her privately, she did share her contact information, so you can do that. And Gabbie just put the Gabbie just put the survey in the chat. If you think someone could benefit from this webinar, there will be the recording on the website within this business day. So before 5 p.m. tonight, you'll see this webinar on our website to watch or share with people that you think could benefit from it. I don't see any questions, so I'm going to sign off for everyone. Gabbie, thank you again so much for your time and expertise today. You're a valuable team member at EFR, and we're so glad that you're working on behalf of harm reduction in the community, and keep doing the hard work. It's worth it. Thanks, everyone.